I'm joined today by Dr. Sandro Galea, who's a physician, epidemiologist, and dean of the Boston University School of Public Health. His new book is called Healthier: 50 Thoughts on the Foundations of Population Health. It was published in June. It's so great to speak to you. Every time there's a natural disaster, we hear a lot about immediate disaster relief. We sometimes hear a little bit about climate change, but we don't necessarily hear as much about the broader public health implications that there sometimes are. So talk to us a little bit about your work and sort of how all of these different pieces fit together.
Yeah, the challenge, I think, is very much is that we have a very reactive approach to disasters in this country and in the world, really. That an event happens and we have this outpouring of attention and empathy, which I think is all terrific. The problem is that we have been terrible at thinking about disasters as part of a long-term continuum. And I think the challenge is that we tend to say, well, we don't know when disasters are going to happen or where they're going to happen. So as a result, we'll just wait until one happens. But the truth is that we do know that disasters happen. We do know that they're going to happen. We actually have a fairly good sense of where many of them will be happening. And what we should be doing is focusing on being prepared for events. Not just that, we should also make sure that we are ready for the medium and long term after these events. Because the truth is, after injuries and after the acute post-disaster phase of danger passes, that is when you start seeing the other conditions set in that result in the long-term consequences, particularly health consequences of these events, which are mostly in the mental health realm. And unless we are both prepared for events to happen and then when they happen, settling in for a long haul effort, we are substantially shortchanging the people who are affected by these events.
It sort of seems like the inherent nature of our socio-political system does not really help to think about these issues in the way you're suggesting. I mean, one example would be hurricanes are acute events. We know a few days beforehand that they're going to happen. They have a certain start, beginning, middle, and end, and then we enter what's called the recovery phase. Compare that to, for example, heat, excessive heat, which is probably in 2017 going to kill more people than the hurricanes did, but it's an ongoing issue. It doesn't have a particular beginning, middle, and end. We have elections. Members of Congress are reelected every 2 years. The way the budget process is done is once a year. It seems like the sort of underpinnings of our political system and how we even prepare for these types of issues lends itself to the acute hurricane versus the longer term issues. Is that, do you agree with that?
I do agree with that. I think it's a combination of our political system, as you say, and our collective cultural attention span. And we focus very much on short-term results and on short-term wins to the detriment of longer-term ideas and longer-term solutions. Let me be concrete. Let's be concrete. We know that the groups that are going to be most affected, most hurt by disasters are those who are marginalized, socially isolated. And we know that that's consistent across events. And one can, with extraordinary predictability, say this is going to happen wherever an event happens. We also know which are the parts of the country that are more likely to be affected by hurricanes. So you would think that we could take a bit of a long-term view and say, how do we deal with these populations so that we don't have these hundreds of thousands of people who are deeply vulnerable to an event? But we do not do that. We wait until an event happens. Then, of course, we see acts of heroism. We see injection of large amounts of congressional monies. But people, unfortunately, have already suffered. And that suffering was entirely predictable and preventable.
When we think about some of these disasters and sort of what we mean by prevention, where in this is the conversation about whether certain parts of the United States, or certainly the world is also, there are other parts of the world that also have this question, should be sort of depopulated, or whether they should be re-inhabited after a disaster? I mean, we sort of know, based on what science tells us, about the parts of the United States and the world that are going to be increasingly at risk due to extreme weather events or the rising sea level. At what point do we have a conversation about whether some of these areas should even be inhabited at all?
It's a really sensitive conversation, right? It's a sensitive conversation to say, should people who have made a home in this part of the country rebuild? Should this be an area where we have human habitation? I think it's a tough conversation, and it's certainly a conversation that cannot and should not be had in the immediate aftermath of an event. It's a difficult conversation that needs to take into account social connections, needs to account the amount of disruption to people's lives and social networks that would be occasioned if we chose not to build in particular areas. And the time to have that conversation is not when everybody is under duress because of an event. The time to have the conversation is now, when there is no such duress. So I think it's emblematic of the need for a larger conversation about disasters, their potential consequences, and having that conversation not when the winds are howling, not after the winds are howling, but at a time when things are calm, when we can actually have a rational discussion about the scope of potential damage when there is no immediate threat.
Yeah, I do understand that. At the same time, I mean, to take the issue of gun safety as an example, sometimes you can really only have a conversation after there's been an incident. And, you know, we saw President Obama criticized for talking about universal background checks after the Sandy Hook shooting. And many critics were saying, you know, you're politicizing this because you're talking about it after there was an event. If you talk about it when things are calm, don't many people understate the importance of having the discussion? I mean, I think it's tough either way, but I think there's another side to that.
No, I see the point, and I think if there ever was a time when really when we should be having this discussion, it's now. After seeing Harvey, Irma, Maria, probably the last biggest time when such a discussion was really right in front of our face was after Katrina, about 10 years ago. So that's fine. That's fine. I think if these events can serve as a stimulus for the conversation, that's a good thing. That we should have the conversation. But what should happen then is we should have the conversation and keep having the conversation rather than stopping and letting all this fade from public view, so that a month from now nobody even remembers what the hurricanes were. So if what it takes for the public conversation is events to nudge us forward, then so be it. But we know we're not going to resolve this conversation in a week or in 2 weeks or even in a month. But that conversation needs to then stay high on public agenda.
I'd like to touch on some sort of ancillary or related issues when we talk about natural disasters and public health. There's been a debate over the sort of carrying capacity in terms of the population of our planet. And there's sort of two sides on this. One side is that based on our current energy consumption, we're getting very, very close to what we would maybe colloquially refer to as overpopulation on the planet. The other side is, you know, the truth is people are concentrated mostly around urban areas, and that a lot of the planet is still wide open, and there's more than enough space for many, many times larger a population than we currently have. What's the right approach when we want to consider the impact of the world population on public health in terms of thinking about that population question?
I think the right approach is recognizing that the reason we have had a more human impact of disasters in the past 20, 30 years, and we know we have from databases that look at disasters, are really two factors. Number one is global environmental climate change that has resulted in more natural events, mostly hydrological events. And secondly is the growth in cities, and the growth in cities worldwide that are largely in areas that are near water and are affected quite a bit by this global environmental climate change. So those two factors result in more human impact of disasters over the past several decades. Now, how does one approach that? I think the approach to it is to say urbanization, by and large, is a very positive force. And we are going to keep urbanizing. We know that health indicators in urban areas are by and large better than non-urban areas. So the question is not how to stop urbanization. The question is, how do we build healthier cities? How do we build cities that are safer, more resilient, more resistant to the events of disasters? On the other angle, which is global environmental climate change, this is one of several of the downstream consequences of global environmental climate change. And this should serve as a collective global clarion call to the fact that we need to tackle that. So I tend to think that arguments about population size are really distractions. We know we have capacity to do a lot better than we're doing given how we're currently living. And I think we can turn what in the context of disasters has been a disadvantage into an advantage if we create cities that are built healthy, that promote health, and if we mitigate human-made climate change that is putting these cities more at risk.
Well, the urbanization topic is really, really interesting to me. Of course, you're in Boston. Our studio is also in Boston. And Boston is very interesting because it is a very healthy metropolitan area overall. But within Boston, there are significant inequalities in both access to care as well as even life expectancy. I mean, there are drastic differences in health outcomes on a number of different indicators in neighborhoods that are just a couple of miles away within the city of Boston. So can you talk a little bit about, in the context of urbanization and dealing with climate change, how inequality should be considered and how we can deal with that in a public health setting?
Yeah, that's a terrific question, and I've written about inequalities in Boston as well as in other places. The uh, the truth of the matter is that when disasters happen, they do not hit urban inhabitants evenly. They hit them disproportionately, with a disproportionate burden on the vulnerable, the marginalized, socioeconomically disadvantaged groups. That is true in Boston as it is anywhere else. A city like Boston is a good example. Boston is a wealthy city, and it's a city which, for example, has the highest physician population ratio of anywhere else in the country. And yet, in a place like Boston, you have fivefold differences in the prevalences of some disorders, just 2 to 3 miles apart. And that has nothing to do with access to medicine, nothing to do with access to doctors. It has everything to do with underlying social, economic, cultural conditions that ultimately create health. And when disasters happen, it is the vulnerable socioeconomic disadvantaged groups who cannot evacuate, who do not have the resources to buffer them from the losses incurred by disasters. And it is that group, inevitably, that ends up being hit the most, both in terms of physical health, mental health, as well as the long-term consequences of disasters. We did a study where we looked at this, for example, after Hurricane Sandy in New York City, showed exactly that the groups who had resources mostly got out of the way, mostly were able to ride out the storm, mostly were able to rebuild fairly quickly. And then you have the group that is marginalized who gets affected. And I think one of the challenges we have is when we think of socioeconomically disadvantaged groups, we tend to think of, well, that's a small group. But it's not a small group. We're actually talking about half the country, about half the country. And there's ample data that shows that we have had a separation between the wealthier half and the poorer half of the country. Half the country is 50% of people. And that group is incurring the much heavier burden of the health consequences of how we're evolving as society than they used to incur 30, 40, 50 years ago.
We've been speaking to Dr. Sandro Galea. His new book is Healthier, 50 Thoughts on the Foundations of Population Health. I really appreciate you joining me, and these are all issues that are certainly not going away anytime soon, so we would love to have you back.
I'd be glad to come back anytime. Thank you for having me.